Thanks very much. It's a pleasure being part of this virtual course presentation at Health Campaign Effectiveness Coalition meeting 2021. I am Isis Umbelino, representing Bridges to Development and all our partners and collaborators in this project. A project looking at how to build the links between campaigns and primary healthcare, evaluating serosurveillance and primary healthcare referral, doing integrated NTD campaigns in 2 countries of Western Pacific. But today, we are focusing out on a specific activity from our project, the target, transitioning the training strategy for skin disease in Vanuatu and the West Pacific. But before I start diving in on this activity, I want to acknowledge our partners and project team. Our project lead, Julie Jacobson from Bridges to Development, Aya Yajima from WHO, our partners from Papua New Guinea and Vanuatu, and research institutions that support this project. It is important to understand that the grant and this work is building upon a far larger project which we call PINE, Pacific Integrated NTD Elimination Project. And this is a 3-year project supported by Takeda Pharmaceutical. Through this, we are looking to eliminate or control up to 6 neglected tropical diseases in 2 countries, Papua New Guinea and Vanuatu, aiming specifically to innovate and integrate interventions on how to document and validate those while using a whole society approach. The Health Campaign Effectiveness project, supported by the Task Force from Global Health, it is nested within the PINE project, looking specifically into integration. The overall strategy to enable integration is grounded in 3 pillars. 1, training, empowerment, and peer-to-peer information. This rationale are the lay ground from 3 activities. 1, to conduct training of healthcare workers in SCI entities. 2, conducting MDA, and 3, follow-up. So let's take a look on the process. Prior to our intervention, a training strategy was already in place. Therefore, our goal was to 1, to strengthen materials, 2, to improve learning attainment, and 3, to increase healthcare work confidence and use of resources. The strategy was iterative and included several rounds of interactions between partners, the Ministry of Health from Vanuatu, WHO, and us from Bridges to Development. The strategy was trying to identify what was working, what was missing, what needed improving, and what was the message that we want to convey to healthcare workers. In the left corner, you can see the schematics of what we called the original training. We work on transitioning the original training from expert teaching strategy to a more participatory and holistic one. We shift the emphasis from presentation of individual diseases to building from health center process, so case managing, reporting, and community follow-up. The style transitioning from technical language to a more accessible one. At first, the learning objective was to enable healthcare worker knowledge of disease characteristics, and now it's shifted to enable healthcare worker confidence and competency. We want to emphasize that this strategy did not seek to get rid of expert knowledge. On the contrary, we want to enable healthcare workers on how to make sense of it, and especially how to better use resources. Our goal is accessibility and integration. In your left, you can see an example of job aids from leprosy to assist healthcare workers on MDA assessment, and referral. Besides job aids, we have also developed 2 skin disease courses, 2-day skin disease courses, and a facilitator guide. We also developed a skin disease manual. This will be provided the base for the training for Papua New Guinea and Vanuatu. As mentioned before, that restructure also comprised the health training. The training takes 2 days to be completed and has an overall goal to build upon healthcare work experience and share learn between participants to increase healthcare worker confidence and competencies in managing the care experience of patients with skin diseases, including follow-up to families and communities. The strategy is case-based, problem-solving learning based on healthcare workers' experience and tailored to the local context. Therefore, it is not a conventional course. On day 1, is divided in 3 sessions. So in session 1, healthcare workers are invited to reflect on their own experience dealing with skin diseases. And the goal is to then to understand and learn how to identify, diagnose, treat, and manage skin diseases through context-based case studies. On session 2, healthcare workers are invited to listen to a lecture to learn and recap skin diseases characteristics and how to assess skin infections. On session 3, it's aimed to assist healthcare workers in using resources available to them, again, to develop confidence, knowledge, and the approaches to improve skin disease diagnosis, treatment, prevention in their context. Day 2 is divided in 2 sessions. Session 4 is course of action and report. There, healthcare workers are invited to compare and share best practice to improve skin entity diagnosis, treatment, prevention, and communication, but also understand and learn how to report skin diseases through government systems. And finally, on session 5, healthcare workers are invited to self-reflect and draw some lessons. So we're going to ask healthcare workers to develop a brief plan to improve their practice based on actions implemented in their local contexts. We expect with this strategy to develop, again, healthcare confidence, knowledge, and tools. 2, to improve healthcare working communication with patients and the community about skin diseases. And finally, 3, to compare and share best practice between peers and with experts. We also revised the M&E strategy. Original material measure learning attainment with quizzes on technical knowledge, emphasizing memorization. We transition to measure confidence. We also added measurements in the learning experience as well. One of the biggest challenges that we expect is facilitation of the training, since we are transitioning to a conventional to a more participatory model of training. So in order to remedy this, we developed a facilitator guide, and the team will also be facilitating an orientation session for the facilitators. Additionally, in order to the training to be successful, participants need to engage, and they might not be willing to do so. Therefore, facilitators are oriented at the beginning of the training to adjust participants' expectations and explain what the course will require. Thanks very much. Best regards from the Bridges to Development team.